It's very, very possible that no one even understands what a subsidy is. All this talk and all this fight and a government shutdown over Obamacare subsidies, do we actually know what it means? Are we talking about actual cash? Are we talking about a tax credit? What's the difference here? Does it actually make Obamacare work, or is the fundamental problem that Obamacare doesn't work and all we're doing is kicking a problem down the road? And what is the problem? Is the problem that we don't treat healthcare like we do other places in the market, or is the problem that we don't recognize that healthcare is special in and of it to itself? In and of itself, into itself. I don't even know how you would say the words. You think I'd be better at talking, being on radio and all. Tony Katz Today. Good to be with you. Let me bring in Avik Roy. Avik Roy is the man behind FreeOp. This is the Foundation for Research and Equal Opportunity. He serves as the chairman there and president. His background, his history is not only as a scientist, it's training at MIT, but then as Obamacare came to be, and that's where I met Avik all these years ago, is really about healthcare policy, about what it is in the very, very detailed granular level that we're dealing with here. So, Avik, good to see you, man. Always a pleasure to have a chance to talk to you. Let's start with, I guess, a baseline. When the Democrats are screaming about subsidies for Obamacare, what is it that they're actually talking about?
They're talking about an extra bonus enhanced set of subsidies that they passed during COVID. Initially, it was supposed to be a 2-year emergency measure. Then it got extended for another 2 years. And because of that extra 2-year extension, it's set to expire at the end of 2025. And they want it to extend further, as they always do, right? There's what is it that Reagan said? The quickest way to everlasting life is to be a government bureau. So
we talk about how they want these dollars to extend. As Reagan also said, I'm from the government, I'm here to help. The most dangerous words in the English language. This is weird to people, these subsidies, because Obamacare was supposed to be, it is the Affordable Care Act. It's the ACA. It's supposed to be much more affordable. It's supposed to make it easier for people to get health care. And clearly that didn't work. So was this a lie from the beginning, or was this one of those things that the pathway to hell is paved with good intentions?
Can I say both? Because the lie was that Obamacare did make the underlying cost of buying health insurance on your own much more expensive. So just to rewind a little bit, we subsidize health insurance for almost everybody in America. If you're over 65, you get subsidized health insurance through Medicare. If you're super poor or disabled, you get subsidized health insurance through Medicaid. If you get insurance through your job, there's a massive tax subsidy for employer-sponsored health insurance, where literally, like, if your employer gives you $100 in wages, you pay income taxes on it, you pay Social Security, Medicare taxes on it, state and local income tax on it. But if that same employer gives you $100 in health insurance, you pay no taxes on it. So there's a tax subsidy for employer-based insurance. So there was a gap in the market pre-Obamacare where if you didn't get health insurance through your employer, you weren't poor enough to qualify for Medicaid, and you weren't old enough to qualify for Medicare, you were like the only group left, basically working people who were like freelancers or other types of people who didn't get insurance through their employer, who didn't have a subsidy for health insurance. So both Republicans and Democrats in different ways have proposed evening out that discrepancy and saying, let's balance out the help we give to the working poor and the middle class versus what we give to higher income people through employer-sponsored insurance, what we give to the elderly, what we give to the poor. So that part is okay. The part that Obamacare really screwed up is it heavily regulated the kind of insurance you could offer to people who didn't get it through their employer. And that individually purchased or non-group health insurance is what Obamacare has made super expensive and what made the subsidies much more necessary, because if you're going to triple or quadruple the premiums that people have to pay, then a lot of people aren't going to be able to afford it.
So we can say that Obamacare did not make healthcare cheaper.
Oh, it definitely didn't make healthcare cheaper. Now, the way supporters of Obamacare describe it is they made it affordable by subsidizing it, right? So if your premium, your monthly premium went from $200 a month to $1,000 a month, but the government is covering the difference or more, even more of the difference, so that your net, premium net of the taxpayer subsidies is $150 dollars a month instead of $200. Maybe for you, your health insurance is quote unquote a little bit more affordable. Maybe not, because deductibles and copays have also skyrocketed under Obamacare. But all this to say that actually, if you look at the underlying premium, the underlying cost of the insurance, it's exploded in cost. And that's why Democrats want to perpetuate these enhanced subsidies, because people like me 15 years ago, as you know, Tony, because we talked about it on your show 15 years ago, we were saying, like, look, this is going to drive up the underlying cost of insurance, and these subsidies that Obamacare has appropriated for that purpose aren't going to be enough to cover the higher underlying cost. And sure enough, here we are, 15 years later, and the Democrats are saying, let's paper over the fact that Obamacare is too expensive, and effectively let's bail it out by adding on these additional subsidies. And so the thing that I've proposed, a lot of Republicans, a lot of conservatives saying, they're seeing what I've just described to you, and they're saying, screw that, let's just end the subsidies. Why should we perpetuate these subsidies to bail out a program that we said all along was going to be unaffordable? Okay, so that's the baseline Republican or conservative point of view, which I sympathize with. But I'm arguing for a somewhat different strategy. What I'm arguing is that the only way to deregulate Obamacare, or to reform the regulations in Obamacare that have made the health insurance under Obamacare so expensive, is you have to pass a law that can get 60 votes in the Senate. You have to be able to overcome a filibuster to deregulate Obamacare. As we learned in 2017, when Republicans tried to repeal and replace Obamacare, they could only defund it using the reconciliation process, but they couldn't deregulate it. The regulations under current Senate rules require you to get 60 votes in the Senate, not 50. And so what I'm proposing is give the Democrats a short-term extension that phases out the subsidies in 1 or 2 years in exchange for permanent deregulation of the exchanges so the underlying premiums can go back down. Because if we just let the subsidies expire, we haven't really solved the problem. The underlying cost of insurance is still expensive because the regulations are still in place. So the problem we really need to solve, if we want health insurance to be affordable for people, is how to deregulate Obamacare. And for that, we're going to need some Democratic votes.
Talking to Avik Roy of FreeOpp, FREOPP.org, the Foundation for Research on Equal Opportunity, where he is the founder, co-founder, and chairman. This brings us to this idea of, can you make healthcare affordable? I have made a rudimentary argument that it seems odd to me and unnecessary to me, and maybe I could go so far as to say dangerous to me, that we treat healthcare differently than we treat the mechanic. We treat our doctor different than the mechanic. We have a problem with our brakes, we go to the mechanic, we pay for new brakes, we get new brakes. We have a problem with our hip, we go to the doctor, and the next thing you know, there's 27 levels in between me and the doctor, where if I don't have insurance, the Tylenol costs me $92,000, and if I have insurance, it costs me 17 cents. There's a fundamental issue here in how we address this as a marketplace to begin with. So this is where I find myself constantly saying we're doing this wrong. So let me start with a basic question to you. Do we have the capacity in the United States to make healthcare affordable?
There's a lot of different ways to answer that question. I'll put it this way.
I got nothing but time, kitten. Go for them all.
If you were to put me in front of a blackboard and say, how would you redesign the healthcare system in America so that it were affordable, competitive, innovative, and had a lot of choice, and didn't cost the government nearly as much as it did now, I could design that system. In fact, at FreeUp, we've put forward a plan that's been introduced in Congress as the Fair Care Act, sponsored in both the House and the Senate. In fact, two members of the Indiana congressional delegation have been heavily involved in it. Jim Banks, back when he was a House member, and then your current governor, Mike Braun, who's obviously now who's the governor, but was a senator until recently. He was the one who introduced it in the Senate, and Jim Banks, when he was in the House, he introduced it there. So we've put forward a plan, and you can talk to them about it next time you have them on, that would actually solve this problem. That would, in a very politically gradual way, because you can't disrupt health insurance and healthcare for people, migrate us more into a system that's fiscally sustainable, that actually cuts taxes, reduces spending by trillions of dollars over a multi-decade period, solves the entitlement problem, and actually preserves the things about the healthcare system that we actually like, the innovation and the choice where we have it. So it's possible to do. The challenge is that particularly Republicans are risk averse when it comes to healthcare. Their experience of 2017 scarred them. Most Republicans in Congress believe they lost their majorities in Congress because of this repeal and replace battle in 17. And so a lot of them just don't want to touch it. They don't want to be bothered by healthcare. They don't want to think about it. And the problem with that is
later and 2 terms of Trump, and you're saying that that's still the scar from when they fell off their tricycle at the age of 4 is still haunting them.
Unfortunately, yes. And the challenge is healthcare gets more and more expensive every year because we aren't fixing it. And not only that, healthcare spending is the biggest driver of the federal deficit. And so every year the deficit and the debt get bigger because we haven't fixed healthcare. So these problems are coming to a head. The Medicare Trust Fund is going broke in, I believe, 2033 or 2032, which isn't that far away. That's 7 years away. And, Paul Ryan tried to fix all this stuff in 2012. He proposed that big plan that if we had passed then would have made a big difference. But here we are now. It's 2025, and we're rapidly approaching that fiscal cliff. And it's going to be pretty scary when we do.
Talking to Avik Roy of FREOPP, FREOPP, FREOPP.org. This is the Foundation for Research on Equal Opportunity, where he is the co-founder and chairman. And rarely do you hear people singing the praises these days of Paul Ryan. I mean, you got to take that hit where you got.
He's an unfashionable name to drop, but I think people are going to regret not listening to him about Medicare reform in particular. Back in 2012.
But if you could argue that the Democrats had any success in this shutdown, which I think there's very little they could point to, it's that people are now asking this question about subsidies.
Right.
And that can easily be a backfire to them, where people could say, well, we don't want Obamacare at all, and we're sick and tired of paying for people who aren't paying for their own insurance. You're making a secondary argument. You're saying, wait. We need to deal with an underlying issue that Obamacare is, not just the money issue that Obamacare is. And that's where you talk about engaging a deregulation. But I think the thing that always comes back is, well, what is your plan? You talk about what you had with now Senator Jim Banks and now Governor Mike Braun, who were a congressman and a senator respectively, when you were pushing this forward. Does it lead to government being involved in healthcare? Is the only way to have healthcare, good healthcare, worthy healthcare, valuable healthcare, affordable healthcare, is government involvement? Or can the market handle this?
The market can handle it. In fact, the market should handle a lot more than it does. There are a couple things that you have to account for if you want to have a system that is maximally light on government and heavy on the private sector competing for your business. And the first thing is that there's a tendency towards regional monopolies in healthcare. So in a lot of parts of the country, and in Indianapolis, you're fortunate this isn't as much of a problem in Indianapolis, but in a lot of regions of the country, there's one hospital system that basically owns the state or owns the metropolitan region. So there's no competition. If you tear your knee, or you have a stroke and you need to go to the hospital, there's no one to bargain with because there's one regional monopoly that basically owns the entire state. And so they can charge whatever they want in a quote unquote, not really a market system, but in a private system. It's no different than a government monopoly. It's just a private monopoly, right? So that's not great. And the other thing is you do have legitimately, people who are too poor to afford health insurance, or people who, because of a health condition, let's say somebody has a genetic disease or they're disabled or something like that, where the cost of caring for them is way greater than what they can afford, you're going to need some sort of way of helping those people who otherwise can't help themselves. But having said that, you can look around the world, and there are plenty of countries that do it way better than us. One I like to talk about a lot that we talk about at FreeOp is Switzerland. Switzerland has universal health insurance. It's all private. There's no government health insurance. All the insurers compete for your business. They subsidize it for people at the bottom end of the spectrum economically, but everyone else has to shop for their own health insurance, and it works really, really well. They have access to any doctor they want. A lot of the pharmaceutical and biotech companies are headquartered there because it's such an innovative ecosystem. They have low taxes. That works pretty well. And I think we have a lot to learn from Switzerland if you want to look at a system that could be a model for American healthcare reform.
Avik Roy, FreeOp, FREOPP, FreeOp.org. Go check them out for yourself. I appreciate Avik taking the time to be with us. Much more to get to. I'm Tony Katz, and this is Tony Katz Today.
Thanks, Tony.